Welcome to Healthcare Scene Interviews, where we sit down with top leaders in healthcare IT. I'm John Lynn, the founder of HealthcareScene.com, and we're excited to bring you this special interview. It's an interview I've wanted to do for a long time, so I'm really excited to have here with me Howard Messing. He's president and CEO of Meditech. Welcome, Howard.
John, thank you. I'm looking forward to talking with you. This should be an interesting discussion we have.
No, definitely. I'm excited to hear about this because it's really amazing to think that Meditech started on August 4th, 1968. That's 50 years ago, and you've been around for 44 of those years. That's quite a ride that you've been on. How does that feel, kind of looking back on this whole journey of 50 years?
Well, it's hard to believe it's been that long. When I first joined Meditech, to be honest, I only planned to stay for a year. And here we are 44 years later. And it's been a wonderful time for me as I've seen both my own career and maybe more importantly, the contribution Meditech has made over the last 40 years go from just a small one application kind of company to one where we feel we're very central to the whole healthcare process for our customers.
Yeah, I mean it's an amazing history. It's interesting you thought you'd only stay for a couple of years. That's kind of the modern culture that you were doing 50 years
Yeah.
ago.
Yeah.
That's quite a change. Well, I mean, while Meditech is 50 years old, it even started really before that, right? In 1964, when Neil Papalardo, which I always kill his name, my apologies, Neil, and also Kurt Marble, they developed the mumps platform there at Mass General Hospital. So give us some context for those of us that maybe are a little younger like myself, how revolutionary was mumps at the time, back in 1964?
Well, I think it was quite revolutionary. Neil and Kurt both graduated from MIT and went and joined the brand new laboratory of computer information, computer science at Mass General. And their goal was to design a technology and a system that could be particularly useful in healthcare. Back then, most people thought of computers as big mainframes. And instead, what they wanted to do was create a system that was very interactive. And that's what mumps was, and it was fairly innovative. It also had, without getting too technical, it had a built-in database right there inside the computer language, which again was a very novel concept. And they found, particularly for the kinds of problems that healthcare tries to solve, those were very useful things to have. And they developed that, began to automate some of the processes at Mass General. And then by the 68, 69 timeframe, Neil decided that he needed to expand his horizons and left Mass General, founded Meditech, found a little of what today is called venture capital to help him get started, and formed Meditech. And the rest, as they say, is history. So mumps really was quite innovative, although to be honest, we haven't used mumps ourselves since the early 70s, even though people often associate that with us.
Yeah, well, and that's what's so interesting. So much of healthcare is built on the back of mumps, and yet you guys moved away from it. But I think what's interesting there, though, is really that culture of really having to create the whole technology stack. I mean, that's kind of what Neil did with mumps. Is it wasn't created; it was this changing mindset that was happening in that area, and that really, I think, most people don't appreciate how much that's part of the culture of Meditech. This developer-driven culture. I was talking with some people from Meditech, and they talked about how for the longest times you even had your own phone system, which you developed in-house, or your own email system, which was developed in-house. Was that really that culture of that era?
I think that's a good point that you make there. When we started, we talk about the mumps language, but the truth is we developed an operating system, we developed a database, we developed networking protocols. Remember, this is before TCP/IP had ever been invented. And when we wanted to hook more than one computer up, we had to do that ourselves. So that has been our culture. We knew the full stack down from writing device drivers to interacting with physicians and clinicians, the whole thing. Now, over the course of our history, as the industry has developed and there have been good alternatives, we've moved away from that. So we no longer obviously write our own operating system. We no longer write our own networking protocols. and we are actively pursuing, industry standard databases for our long-term future. But that created a culture here of really trying to understand the complete stack of what's being done and making sure that all the pieces fit together, appropriately well. And I think has served us throughout our history.
Yeah. No, I mean, I think it's important to understand that type of approach since, I mean, you are a company driven by a bunch of technology programmers and experts. So, and I think it's a fascinating part of that era, right? Just the fact that, were you connecting them with terminals? Is that kind of, was that the technology of the day, or was it
Well,
something?
actually, at the very beginning, it was teletypes. We used to automate a entire laboratory. Our first really successful product, we had a number of products before that, but our first really successful product was our laboratory system. And we could automate a laboratory on 1 or 2 teletypes on a shared computer running in our office. And we did that for a while. So it started with teletypes, then became what was called at the time dumb terminals, evolved to the point where we are today.
Yeah, it's amazing. I mean, when I first started in the EHR industry, which was only 14, 15 years ago, I replaced it some dumb terminals, which is crazy to think that they were still surviving. But I mean, I think that's part of the story too. But yeah, so I mean, I think it is interesting too that Meditech started in the lab. How did the adoption of this initial lab product go back in the 70s? What was users' reaction to it?
Well, in the laboratory, it was accepted very well. We were very much, I would say, a back office system then, in the sense that I would say administration didn't even know that they were buying a system at the time. It was like buying a piece of lab gear, although the laboratories themselves were, for the most part, not even automated at the time. They didn't have all the machines that they have in laboratories today. It was at some places it was a hard sell. People, just like you would imagine, people didn't want to be replaced by computers, and we had to convince people that there were a lot of efficiencies and increased safety that would be achieved if you bought a system from us. As the laboratory systems matured during the 70s and 80s, of course, we expanded, and today in time we obviously don't use teletypes anymore. But the full range of gear that is in the laboratory and automates the laboratory is hooked up to things, and there would be no way to run a modern laboratory without a laboratory system.
Yeah, I mean that evolution is pretty incredible. So did you quickly move to other departments, or how did it spread from the lab? What was other departments' reaction when you were working in the lab?
Right, that's exactly the path we took. I would say the decade of the 70s was when we began exploring the various different departments within the acute care setting. That's maybe also another point to make out, is that we started in the acute care setting and branched out later on into more ambulatory and non-acute settings. But in the 70s, we started exploring various departments. Pharmacy, in fact, was one of the early ones that I was involved with. Radiology was another department that we did. Admissions and medical records were in effect departmental systems. That was pretty much the decade of the 70s. In the 80s, we began to tie that together with both order entry systems and financial systems. And as a company, we began to learn about how those things tied together and the importance of automating that. Order entry, if you went to a hospital in the 70s, you would see on the nursing station, there'd be usually a tray hanging on the wall with 40 or 50 different order slips. And if the doctor wanted to order a lab test, they'd have to fill out a slip. And it was, by today's standards, quite a manual and error-prone system. So that was actually, I think, a very big advance for us, and began the march of being able to automate the hospital as a whole, the acute care setting as a whole, as opposed to seeing things as a departmental-based operation. And then in the 90s and beyond, we started branching beyond that, adding more services for physicians, tying financial systems and clinical systems together. And over the last few years, obviously, the reporting side has also been added to that. And that is particularly germane in today's era, where we start talking about things like population health and cross-patient, cross-modality and cross-patient care of patients.
I think that's a good summary of the evolution. And what's fascinating though is your insights kind of the order, the orders they had to just grab from the wall, and how, I've often commented on EHR how we so quickly take for granted the benefits of technology, and all we can see is the problems or the challenges, and the simple example I generally use is that now EHR notes are legible, right?
Mhm, mhm.
But we take that for granted now that it's all electronic. Whereas before, it's like, oh, you couldn't read the doctor's handwriting; it would annoy you. You'd have to go bother them, say, what does this say? Or deciphering. That's another great example, I think, of that principle, right? Is we took for granted that before you'd have to choose from a whole stack on the wall, and now we just type in the order and it comes right up. So
Right.
it's a fascinating evolution. So how did this spread back in the 70s, right? I mean, I think we take for granted now that, everyone has email and social media, and, we have conferences all over. We can travel wherever. And how did this spread in the 70s? How did hospitals hear about you and, what Meditech was doing?
Well, we certainly recognized at the time that there was not a culture of IT systems in hospitals. Today in time, when we go sell a system to a hospital we haven't done business with before, we're replacing systems. Back then, we were replacing manual systems, which is quite a different process than today. So there was a lot of proselytizing that had to go on. There was a lot of work we did at conferences, a lot of feet on the ground. We, I think, were one of the earlier companies to have a large body of salespeople who really weren't salespeople. They were really, I would say, proselytizers. They were people who would go out and try to spread the word that this is what we have and this is what it can help you achieve. And we found ourselves growing throughout the United States to begin with, and then beginning in, I'd say, the mid 80s into Canada. And it was at the same time the computers were in everybody's mind because it was the introduction of the personal computer. So people began to accept it a lot more. And I think a lot of our growth was driven by people wanting to be able to use computers and be able to make a difference.
Probably easier to be a proselytizer when you have news all over talking about the computer revolution and how that can make you more efficient and those types of things.
Absolutely. I mean, prior to that, computers were, as I said before, considered to be big mainframes that did billing systems and produced magnetic tapes. We had a very different approach. We thought integrating all of the various facets of healthcare together and making data available at its point of use was the important thing.
Nice. Well, and that's why you're so successful. I mean, if we kind of fast forward to 1979, you're up to 68 employees, so, good sized company. But one of the interesting things about Meditech is that, you have a real culture of promoting from within the company. You're not really hiring outside people for executive positions. Was this like a really early decision in the company, or, what was the rationale behind hiring from within?
Well, it was, to be honest, it was not always the case here. And again, in the early 70s, we did hire a few people in senior positions. Frankly, it didn't work out. And at that point, we had already accumulated a fairly large, loyal base of employees, of staff people, and made that decision quite consciously that we would promote from within. And it has served us well for our entire history. We have a set of people that I'm very proud of that have been here a long time, that know each other very well, and that has provided us with the opportunity to give them career advancement, and has also provided our customers with a stable base of people to work with. And it's just worked out. I'm very proud of being a high-tech company that's had staff who have been here on average somewhere between 9 and 10 years, which is pretty much unheard of for
Yeah.
anyone in this business.
Yeah, that's pretty abnormal. It's great to have that continuity for your customers.
Yes, it is. And on the other hand, we also, to balance it, we do hire a fair number of, I guess I shouldn't say young because it's not an age-based thing, but people new to the industry.
Sure.
We do hire, who tend to be young people. And we find that also is a great source of ideas. And I love it when one of our newer staff asks us, why do you do something? And somebody deigns to answer, because we've always done it that way. And we know that that's not the right answer. So that helps us with that, making sure that we rethink through the decisions, and we do change the decisions that should be changed.
Nice. No, I think it's always a challenge, that answer, right?
Absolutely. Absolutely.
And organizational inertia is a challenge in every organization. So,
Although one of the nice things about having long staff who've been here a long time is you sometimes have an answer for why you did it that way. You can remember what the original reasons were. I find in other organizations that I'm involved with, they know they did it that way always, but they don't know why they originally did it.
So it's interesting. In 1979, Magic was introduced. So how big of a step forward was this for your organization?
Well, maybe it's better to answer that by saying that our philosophy has always been that every certain number of years we should really throw things out, to be honest, and rewrite from scratch. That's a very costly thing for us to do, but we feel that trying to extend our software forever presents some drawbacks. Now, we do support our customers. We do have customers still running the Magic set of software, but as we learn and we get new ideas, we want to incorporate those in what we do. So we do tend to throw out the old and increase the new. Back in 1979, Magic had a lot of things in it that were quite different than the previous version of our software, which at the time was called MI Standard, Meditech Interpretive Information System Standard, which was yet 2 generations past MUMPS.
Wow.
And we rewrote that Magic. Magic has lasted us a long time, but we actually have not been selling Magic now for probably 20 years. It was superseded by a rewrite of the software in the 90s, and then we've recently rewritten our software yet again.
Well, and it's been interesting because you really had that choice, right? I mean, I think you had it with Magic, you had it again with Client Server, and now you have it again with Expanse, where you could have sunset a platform. I mean, I think that's what most tech organizations do, is eventually they reach a point where they say, okay, we're going to sunset that platform and move you on to the new. I mean, that's why we created the new. But Meditech's kind of been different that way, and you've really chosen not to sunset these platforms. You know, as you said, Magic is still running in hospitals today. 40 years later, you haven't been selling it for 20 years, and it's still running. You know, why did you make that choice to continue to support Magic and even Client Server?
Well, we had so many customers running it, and we knew it would be very upsetting to them to have them throw out their old platform. We're very interested in keeping the costs low for our customers. And certainly anybody who bought our Magic platform in the 80s or early 90s can say they've gotten their value out of it. That's never an issue. And because we had the in-house expertise to maintain it. I think the reason that a lot of people sunset platforms is they start running out of people who knew the fundamentals of what they did. That has not been the case for us. We still have people here who programmed in Magic, you know, some number of years ago. I did, for example. Not that I maintain anything myself.
I'm not a programmer anymore either, even though I could act like one.
I'm a recovering programmer.
Yeah, so, exactly.
So I think that those are the main reasons that we kept at it. We also felt that because we wrote the whole stack ourselves, as things changed, we were able to make modifications at relatively little cost inside of Magic to support them. So when Magic was first written, there wasn't TCP/IP, yet we were able to change out the portions of Magic that rely on networking to use TCP/IP. There wasn't even things like color terminals when Magic was first invented. And again, because we knew the basics of the code, we were able to take advantage of that. Having said that, to be perfectly honest, we're starting to get to the point where Magic is still supported. We're still planning to install it, but there are a lot of advantages, we think, for upgrading to our newest software, and there are probably starting to be some things that are going to be very difficult to do moving forward in Magic. We have no intention to, as I said, anytime soon sunset the platform, but we do think there are great reasons for customers to consider moving ahead with our newer offerings.
Yeah, and we'll definitely get into that when we start talking about Expanse and things. But what was customers' reception to Magic when you came out? You know, I mean, was switching as hard then as it is today?
Well, for the most part, back then it wasn't switching.
Oh yeah.
Yeah, for the most part, we were automating, when we introduced our order entry system, we were replacing that thing hanging on the wall. We weren't replacing somebody else's system. So it wasn't a fight to get that part done. It was sometimes a fight to understand what the customer really needed, and to have them understand that it wasn't as simple as mimicking their manual processes. That remains a problem today. Everybody likes the way they do it, and when you bring in a new system and you have new ideas, people still are comfortable with what they've been doing, and we have to explain to them what are the benefits of changing what they do. We see that, of course, most seriously today in the products that we do for physicians, who have a very well-defined workflow that we try to emulate to some extent, but also try to introduce changes that they might find productive if we can get them to give us their time and effort to learn the new workflows.
Definitely. So it's interesting you talked about the customer initiated, focus, that customer focus, and trying to understand what the customer wanted, even back in the Magic days. And as I was preparing for this interview, I found that you held your first user meeting in 1984, which in 1984, this idea of user focused IT is kind of almost amazing to think about, right? So what prompted you to have this user meeting, and how was that different, this first user meeting in 1984 versus what you guys do today?
Well, that's right. I remember that meeting very well. It just seemed like the natural thing to do. We did have a lot of customers who were very excited about our system, and if anything, there was too many ideas coming from customers at the time, and conflicting ideas. There's the old joke that if you have 10 clinicians in a room, you get 20 opinions. And so we thought, to get a handle on that, we would get our customers together, and then within that user group, break it down into the various products that we offered, and work with them on making the priorities for what they wanted to see changed, understanding, first of all, most importantly, what their problems were, and then asking them to help us design solutions for those problems. In the early days, you asked what was different. In the early days, we went so far as producing a list of items that we were planning to do, and let the customers vote on the order of priority that we would work on those. Now, we no longer exactly do that. We do still have focus groups and have our customers help us decide what the priorities for things we work on. But it was very much user-driven in the early days, and was a very useful exercise for us. We felt that by not controlling the user group ourselves, it was an independent organization, that they would be more free in what they said to us, and that's in fact how it turned out to be.
No, and I think it's been incredibly successful. It was interesting to see kind of your reaction thinking back on that first user group. You could see there was a certain joy you had there. I mean, it must have been an extremely exciting time to be working as a tech company in the 70s and 80s. What was it like being a tech company back in those days?
Well, it's still exciting. I don't want to say it's not exciting. It's
Sure.
different. No, it's very different. People didn't know what you did back then. When I started in Meditech, if I told people that I was a computer programmer, they had no idea what it really meant. It was a very strange thing. An interesting little story from back then, when we registered with the state of Massachusetts, and their revenue people, their taxing revenue people came out to see us. They did not know how to classify us. They did not have any idea what a software company was. And they eventually classified us as a manufacturing facility, which in some sense is what we are, but it's certainly not the same as what they intended it to be. So it really was a very different feeling. It really felt like we were on the edge of something completely new. We knew at the time that computers were going to get faster and faster and enable us to do more and more. I don't pretend that I foresaw exactly how crazy it's gotten in terms of what we can do and what we can accomplish. Or do I really know for sure where it's going to be 10 or 15 years from now, although it's exciting to think about. But it was a very much feeling of a pioneer, very much feeling that we were working together on creating something that was brand new for our country and for society. And it was fun. And like I said, it still remains fun.
That's awesome. Yeah, I mean, it's such a different perspective, even the tax classification. I've had that same feeling when how do you classify a blogger? But
Oh, yeah.
it's a small taste of what you were doing, but interesting to think about. Yeah, I mean, as you were progressing, one of the other interesting parts of the Meditech history was really the presence you had in Boston. I think now we look at Boston and see it as a bit of a tech hub, and certainly a healthcare innovation hub with Harvard and many of the other institutions there, MIT, of course. But you guys were creating quite a presence in the Boston area. And I think one of the interesting things you did was buying real estate all over that whole area. You know, Tell us some of those experiences with real estate. My favorite that I have to hear about is that you own a racetrack, right?
We do own
Yeah,
a racetrack. Well, we
you
um,
did.
early on decided that we wanted to be based in Boston, and that we also really thought that we wanted to own our own real estate as opposed to renting. We're and continue to be a privately held company, and that has certain advantages to it. One of it is that you're not as pressured as you are in a publicly held company to show quarterly results. If you think that through to the end, it really means that you can make long-term investments. Not saying that all public companies don't make long-term investments, but early on, it was clear to us that we really wanted to make some long-term investments. And certainly real estate is as good an opportunity as any to make a long-term investment. So we started looking for properties, and as we grew, we found a number of interesting properties to purchase, the one being the one I'm in today that you're talking about in Canton, Massachusetts, is one that happened to have been a horse farm before we bought it. And in fact, it was raising a lot of trotters here. So as one of the conditions of the sale, without going into too many of the details, we had to maintain the property and make it available for public use. So that's what we do. And there is a racetrack. There are no races held here anymore.
Okay.
Although there is once a year, there is a horse and buggy show that takes place on the ground, and I guess that's used. Other than that, the racetrack is used mostly by our staff to go running or walking. But so it has a racetrack, and many of our other properties have had some unique history behind them.
Sure. No, I think it's amazing, and obviously you've benefited from the growth of Boston. It was interesting your comments on public versus private. Is that the expectation going forward to remain private, or is there any sort of inkling of going public at some point?
Well, we've been private since our beginning, so for 50 years.
Right.
There's no push to go public at all in the company. We certainly have been courted at various times in the past by the various entities that bring people public. I remember the first time in around 1982, there was a lot of pressure to go public. The growth period after the recession of 1980 saw a lot of companies going public, and it was something we talked about at the time and very clearly decided was not something that we wanted to do. And it's worked out well for us. We have a very good core of investors in the company. Much of them are employees, and some of the really early investors are still investors in the company. We've managed to pay a dividend for most of our history, and investors see that as their payback. And so long as we can continue that, which I believe we can, we see no pressure to change anything in the corporate organization of the company. So that's a long-winded answer to no, there's no plans to.
No, I appreciate you sharing the insights. I think it matters to the customers as well, and so I think that's important, right? To understand, what your vision is for the future as people, get on board with Meditech. So, let's switch gears back to, Magix is being successful, right, through the 70s through the 80s, really, and then in the 90s, you decided to start working on the client server release. What was the
Right.
thinking as you said, okay, it's time to start working on something different? I mean, we've talked a little bit about, us, we would talk about it as technical debt, right? Let's throw it out and start something new so we don't have all the technical debt of 15 years. I mean, that's a nice programmer terminology, right?
Right.
Was that the thinking, or what else was going on as you decided to release client server?
I think there are a couple of things. One is what you just mentioned, technical debt and being able to start things with a fresh approach. And the other was that the rise of personal computers in the 80s created an environment technically where we thought there was a lot of power on the desktop. And instead of dumb terminals, we wanted to be able to use the power on the desktop to drive systems. And that's really what drove us into the client server kind of technology. There were a lot of ways of doing that, and we chose one particular one that seemed to work well and released that in about 1992, 1993, somewhere in there, as a core technology to replace our Magic technology. Introduced a bunch of other things at the same time, but the basic idea was to be able to take the power of distributed computing and be able to use that to achieve maximum performance at a minimum cost for our customers.
Nice. So, how did that, I mean, was that a good transition, or was that a challenging one to go from kind of dumb terminals? And this gets us into the replacement now, right? Because now you're asking your customers to replace as opposed to new customers. Was that a challenging transition for your customers, or?
It was a challenging transition for some customers. Whenever you introduce a new technology, there's always some teething pains. There's always the issue I mentioned before of, well, that's the way I've always done it, and I don't want to change what I'm doing. We had to justify to our customers what was better about that than the older technology. And to be honest, one of the reasons Magic has persisted is some of our customers were very comfortable with the older Magic technology, particularly in the core departmental systems where people really were, I'll say, data entry people. So I don't want to denigrate billers, for example, but billers sit at their desk doing what's essentially advanced data entry. And the exact system that does that is not as important as, say, clinical systems where you really need quick access to a variety of information at a particular time. So I think it varied throughout the healthcare organization. But most of our customers, and particularly our newer customers, really liked what we were doing. And we were able to generate a significant volume of customers to go to client server, and leads us to the point today where there's a mix between client server and Magic customers, and both of them now looking at moving forward with our Expanse platform.
Yeah, I mean, it's so interesting when you think about it from a data entry perspective. Anyone that's worked on a terminal knows that terminal is actually the fastest way to enter data. Right. It was way better than the GUI as far as speed, as far as accuracy, once you learned it. But the problem was the learning curve was so hard, right? And so, that's where the GUIs and things like that were so much more powerful, let alone connectivity and other things, which, are also advantages of the new platform. So it makes sense why a data entry person or, someone who's doing stuff that they've done forever would rather have a dumb terminal, than a GUI interface.
Right. I agree. That was a big step. Really, it was a transition if you think about it. And I will talk about this more a little bit when we talk about Expanse. But the big transition there was Microsoft introducing the mouse and beginning to have a GUI at all. And there are obviously advantages and disadvantages between using a mouse and not using a mouse. And really, it was the first generation of software where people besides data entry people were using computers. And we thought that it was a big advantage to be able to do that. Client server supported that very well. We managed to introduce the mouse in the Magic version of our software, but it never had quite the flexibility that it has in the client server version.
Sure. Well, and I think the mouse has evolved, the interfaces have evolved. When 3.1 came out versus Windows 95, it was just dramatically different. And I think most of us, didn't even understand what the mouse's potential was.
Right. You're old enough to remember that?
It was interesting. My first one was a 486 on the desktop with a 3.0, so barely. Yeah. So, as your company grew, what were some of the biggest challenges you faced? And, how did you deal with them? Any stories that really come to mind of, hey, we had this challenge that, how did you face it?
Challenges that we faced. Well, adopting new technology is always a challenge. So getting both ourselves and our customers up to speed whenever we introduce a new technology is a challenge. Making sure that our senior staff is up to date. I said before, I'm very proud of the staff having been here a long time. There's also, to be honest, the issue of making sure that they're up to date and using the latest and greatest technology. Fighting that issue of that's the way we've always done it. So we, for the longest time, had a very insulated culture of not invented here syndrome. Where if we didn't do it ourselves, we didn't think highly of it. Now that's changed. I'd like to think that since I've been CEO, that's one of the biggest changes that we've made, is making that happen. But valuing the work that others do and figuring out ways to capitalize on other people's software and other people's techniques has been a big part of what we've done, and that was a big challenge for the company to be able to do that. We've also, and we've had the typical challenges that any particular company has, periods of slow sales, and trying to get through that and yet support our staff during that period. In the early 90s, when the Clintons were doing their healthcare revision, where they were thinking about it, there was a period of about 9 months where we sold nothing. Again, maybe one of the advantages of being a privately held company is that we could, withstand that. We had a board that understood it, and we managed to go through that period and have gone through every period without ever having layoffs, without ever having contemplated layoffs, and being loyal to our staff. And I think that shows itself then back into the loyalties that we had. So that was a challenge. Y2K was a challenge from not from the point of view of technical, because we really didn't have any technical challenges, but making our customers understand what was going on, and being able to get through that and have them feel confident in what they had from us was a bit of a challenge, and it also was in many ways a fun time. There are other things I could talk about. I mean, there's certainly lots of little technical incidents that were challenging to us.
Yeah, it seems like those are the ones you probably like the most as a programmer with background, right? What were the technical challenges that you faced, and how did you overcome them?
There's a famous one we talk about, and maybe this is a little off subject, but there's a famous one we talk about. I forget the exact date. I think it was in the late 80s or early 90s, where we had at that time we had already had customers pretty much all over the world, and we got a phone call from a customer in New Zealand that their system had went down, and we started looking at that, and then an hour later we got a phone call from a customer in Australia, and a couple hours later we got called, or 3 hours later, a customer in Singapore, and it suddenly began to dawn on us that something was going on with the date or time, and this was a famous power of two problem, and it turned out that obviously we had something rolling over in one of our pieces of software, and we had all these customers, and we knew if we didn't patch them, the entire United States would go down by the end of the day. So we had
it was a race against time.
Yeah, absolutely, it was a race. We had everybody at the company, dialing it. Well, at the time it was dial-up, so dialing in to patch systems, and we managed to get it all before it hit the East Coast. But that was quite the technical advantage, and it was a interesting problem for us to deal with. It was kind of a Y2K problem, but it was in 1988. So
yeah, same principle, right? Fascinating to think about. Another thing that you guys have chosen not to do is to not do any acquisitions of other companies. Was this ever really a tempting thing for you to do, to go out and acquire a company, or was it just never part of the culture?
Well, there certainly have been a couple occasions we've been tempted, and this is an area again where I would say never, which I don't mean to imply that we have any thoughts right today of doing that. And if the right opportunity presented itself, you never know what we would do. But our basic thinking there is that we're a technology company and we're selling the importance of integration in all of our software. And unless we acquired a company that was writing in the same technology that we had, we thought that we would only be acquiring customers. We wouldn't really be acquiring a technology that would serve us in the long term. So we decided not to do that and not to purchase anybody who wasn't running in the same basic core technology as we had. We think that when people do that, they're really buying market share. They're not really buying, technology. And the examples that we've seen where that's going on, really people have to hobble together interfaces and have problems then moving forward with in advancing either of the systems from either of the companies they bought. So we just don't think it's a great thing for us to do. You always have to ask yourself, when you're buying a company, why are they selling? Is also another factor in the equation. And generally, people don't sell something that is thriving and doing well. So for all those reasons together, we've decided that that would be our basic approach, is not to grow by acquisition.
Yeah, it's interesting. I mean, even if you look at it as more of a people acquisition rather than a tech acquisition, yeah, that kind of goes counter to your culture as well of kind of promoting within. And, if you acquired, it would create that would be quite different in your culture, I think.
Right, I think that's true. We have, in fact, I use the word absorbed two small companies over the last 15 years. One in Minnesota, one in Atlanta. The one in Minnesota having done physicians' office systems, and the one in Atlanta having done home care. But those are kind of the exception, and they were very different in the sense that they were founded by people we knew. They used our technology to write the software. If either of their founders had wanted to move to Boston, it's very likely that they never would have been in that position. And from the beginning, we owned a significant percentage of both of those companies. So there, I think your point is well taken. And to a large extent, we were acquiring people. And that worked out. It was people we knew. So it worked out very well for us.
Nice. So let's fast forward to the early 90s when you signed a contract with HCA, which at the time was known as Columbia, and they really rapidly deployed all of the Meditech technologies across the U.S. and even abroad. How did you manage that level of growth? That's a pretty big purchase for a company like Meditech, I'm sure.
Yes, we talked earlier about challenges, and that was one of the biggest challenges we had. To deploy over a period of between 18 and 24 months our systems in, I believe it was about 175 sites. Wow. In that period of time. It was a great collaboration between ourselves and HCA. To be honest, they had a great staff that were very committed to doing this. I'm not sure that I would do it again in the same way, because there was a lot of cleanup afterwards. There was a lot of work that had to be done with these 175 sites to make sure that they were happy with what they got. But we really, that's what the customer wanted to do. We created a separate group to handle that. We worked with them on having a very formal, driven plan to make that happen, with lots of checkpoints, lots of feedback and data about how things were going. And with the cooperation of the customer, it all worked out, I think, pretty well. And today in time, almost 25 years later, we still count HCA as one of our best customers and one of the relationships we're most proud of.
Yeah. No, I mean, it's a huge implementation, and the fact that you did it so quick, that harkens to the meaningful use days, which we're going to talk about in the next section. But yeah, that must have been quite an experience doing that in the 90s, right?
Yeah.
Way before that.
Also, again, to be honest, the systems were nowhere near as complex as they are today. Mm-hmm. And in particular, the physician-facing components were there, but they're not order entry. They were not as embedded in the physician's workflow as they are today. I'm not sure if we had systems like we have today that could be accomplished quite so quickly, although I'd be very excited if HCA wanted to put our new system in all of their sites within 18 months. I don't think that's going to happen.
You'd be willing to take that challenge, huh?
I know that. That's why I feel free to say.
Of course. But I don't think a lot of people, everyone likes to talk about the big EHR vendors, and Meditech has always kind of kept a low profile. I think it's somewhat your tech-driven culture, and in your relationship with customers and that approach to sales. But I don't think a lot of people realize how successful you've been. I mean, for example, when I was preparing in 2009, when Hilo Medical Center became a customer, it marked your presence in all 50 U.S. states. That Meditech has systems in all 50 U.S. states. I mean, how does it feel to have had such success?
Well, again, obviously, I'm tired of saying this, perhaps, but I'm very proud of it. It's interesting that Hilo was the last. On a side note, the one state I've not been to has been Hawaii. And I've tried on a couple occasions to get out there. At one point I was going to go, but my wife had some medical problems. So if you're watching this in Hilo, please invite me out. I'm gonna.
You need to fix that and take your grandson. I lived there for 2 years. It's amazing.
But having said that, we do have presence now in all 50 states. I think that it's a testament to the adaptability of our system that we can meet the needs of the various states. The states are not all the same. We find different requirements all over the place. We are adopted well. I'm also proud of the fact that we are in a large part of Canada. We have well over 40–45% of the Canadian market that we have been involved with, and continue to see that as a strong base of operations for us.
Yeah, and we're going to dive into all your international stuff, which I think is super fascinating. But if you look back at this era, right, and in our second part, we'll look at expanse and meaningful use and kind of that going forward.
Okay.
But in this area, are there any big things that you look back and say, I wish I would have done that a little different, or things that maybe not regret, but in hindsight, oh, maybe I would have approached that a little different?
I think that it took us a while to branch out from the acute care marketplace into the entire, horizontal market of healthcare. I think I would have started earlier on that. We didn't really advance out into physicians' offices and non-acute care until good 12, 15 years ago. And I think from the earliest days, we should have done that. We had some early experiences in ambulatory care in the 70s that we didn't feel were we were particularly suited for, and perhaps rather than just abandoning that at that time, we probably should have said, well, let's learn about it and go after that. That's probably one thing I would have done differently. I don't think we'd end up to a place that's very different where we are today, but we might have had a quicker path to get there. Other than that, I'm not sure that there's too many other major things that we would have done differently.
Yeah. Well, and it probably was a different time period, right? I mean, I can't imagine in the 80s, let alone earlier, there was the idea that we have today, I mean, even the 90s for that matter, that we want to integrate ambulatory and acute care. I mean, we've seen this acquisition spree that's kind of changed that culture, and probably wasn't that way back then.
Right. Well, in the 70s, there were a few HMOs. We had a system called AMS, Outpatient Management System. The word outpatient, by the way, being a brand new word in the 70s. 60s, there were no such thing as outpatients. So we had this system, and we sold it a number of times. And in fact, I met my wife as the data processing supervisor at one of the customers who bought that product. But it didn't sell that well because it really was to a limited marketplace, and it was not integrated with the acute care systems we were doing. So we basically abandoned it, and perhaps we should have pursued that more strongly at the time.
Nice. Well, let's wrap up this section, and you've talked about how you're proud of everything you've accomplished. What's the most proud thing you're proud of? Is it the company? Is it the impact on healthcare? Is it a specific time period? What are you most proud of in this part of Meditech's life as a company?
I'm proud of the impact that we've had on healthcare. I truly believe that healthcare is better for what we do. In this time of rising healthcare costs, I'm proud of the fact that Meditech systems are not the most expensive on the market, and that we are able to help our customers get a handle on what they do. And I think that is really what I'm most proud of. In addition, of course, I love the fact that we've created a company that provides jobs for close to 4,000 people and takes care of them and their families, and created an entire culture around the company. I recently got an email from someone who just said, thank you, because in the 1980s, I worked at one of your customer sites, and I was a nurse, and then I moved into IT, and I didn't know anything about IT, and now I've had a 30-year career in IT, and your system did that for me. So that was a very nice thing to receive.
Wow. It's amazing to think of the impact. And, That's a beautiful finish. I think we need to ask your peers. They probably have a lot of things they're proud of for you that we could probably dig into. You seem a very humble man that wouldn't want to claim most of the things. So I think that's great. As I thought about it, when I attended your MD and CIO forum, I met one of your doctors. He's in charge of innovation at the hospital, and he said, the thing I like about Meditech is it matches our culture as a hospital. It's one of caring for the patients. It's one of focus on the customer. In your case, he said, it's one of a conservative approach to providing the best care possible. And I thought that was a beautiful way to describe Meditech and a tribute to you and the work you and your team have done. So thanks so much for sharing. Thanks everyone that's been watching this interview. We're lucky to be here with Howard Messing. He's president and CEO of Meditech. This was part one as we kind of look toward all the way to meaningful use, what Meditech's done. In part two, we'll come back and kind of look at the meaningful use era. We'll talk about the international focus of Meditech and then kind of Meditech moving forward with their Expanse products. So thanks everyone for joining. If you want to see more great interviews like this, check them out at healthcarescene.com.